Nagaland sees yet another spike in the number of new coronavirus infections. The fresh cases are reported from 6 districts of the state, with Kohima reporting 51 cases today. CMO Dimapur says most of the COVID deaths were linked to persons involved in businesses and shops, indicating that transmission must have occurred in the marketplaces and shopping areas. Asks people to take all precautionary measures. And India records a single-day increase of over 47,000 COVID-19 cases today. Tally mounts to 14.83 lakh, while death toll rise to 33,425. Well, those were the headlines. Hello and welcome once again to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from the state. Nagaland saw another spike in the number of COVID-19 cases today, with a total of 75 fresh cases of the infections reported from 6 districts of Nagaland. The fresh cases were added to the tallies of Kohima, Thek, Wokha, Mon, Dimapur and Twensang. In his tweet this afternoon, State's Health and Family Welfare Minister Espangipom said 75 new cases of COVID-19 have been detected out of 450 test results received. 51 were reported from Kohima, 10 in Thek, 7 in Wokha, 3 each in Mon and Dimapur and 1 in Twensang. State capital Kohima, where the lockdown is being enforced for a week beginning 25th July, the number of fresh cases continues to surge. A total of 191 cases have been reported from Kohima within the last 6 days, including today's fresh cases. The alarming rate at which the positive cases are emerging has forced the district administration to enforce a total lockdown in the district for a week to allow health authorities to conduct contact tracing and surveillance within the Kohima municipality. Overall, Kohima's tally has crossed the 400 mark, with 408 cases reported so far, with an addition of 51 new cases today. A total of 123 patients have recovered and active cases stand at 285 in Kohima. Dimapur still continues to be the worst hit district in terms of the number of positive cases of the coronavirus. With 3 more patients added to its tally today, Dimapur has so far reported 542 cases, while 167 patients have recovered. Active cases now stand at 373. Dimapur has also witnessed surge in the number of cases, with 112 cases reported in the last 6 days. Chief Medical Officer CMO Dimapur Dr. Tia Sanap Ponganer, in an appeal to the citizens of Dimapur today, has brought to light the alarming rise in the number of cases. The CMO said the observation has been made during the past week that mortality, especially among the older age group and those with comorbidity, is increasing, and the number of positive cases among the general public is also alarmingly on the rise. Dr. Tia Sanab said the investigation and contact tracing is ongoing, and the Dimapur District CMO team are collecting data on the field at any time of the day, for which the team would require support and cooperation from all. Stating that most of the deaths were linked to the persons involved in businesses and shops, which indicates that transmission must have occurred in the marketplaces and shopping areas, the CMO said that the lockdown has been imposed at the right time so as to keep the people from getting affected during shopping, marketing, loitering, roaming around, etc. The CMO pointed out that many months before the corona actually came to us, most people were very serious about wearing masks and implementing strict do's and don'ts, but after the virus entered the state, everybody seems to be casual and reckless, which he said is a major concern for all. The CMO therefore appealed to one and all to be a better and responsible citizen by observing all the guidelines and measures implemented by the government and other agencies in order to save our state from any major catastrophe. The CMO said that taking precautionary measures like social distancing, wearing of masks, hand hygiene, use of sanitizers, not spitting everywhere, not loitering around, no mass gathering, etc. will go a long way in containing the spread and maintain a controllable state of cross-infection and transmission. Wokha's status of being a COVID-free district remained only for few hours as 7 fresh cases were reported from the district today. Till yesterday, Wokha had reported just a single case and the patient had recovered yesterday, making the district without a single active case. But with the detection of 7 fresh cases today, the tally of positive cases from the district stand at 8 with 7 active cases and 1 recovered. Phek district also saw a surge in the case with 10 fresh cases, the highest from the district so far. The district has so far reported 28 cases, out of which 14 have recovered, which means there are 14 active cases from that district as of today. Mon has so far reported 143 cases so far, with an addition of 3 cases today. 8 patients have recovered from the district and there are 135 active cases as of today. Twengsang's tally of positive cases stand at 46 with an addition of 1 case today. Remarkably, the recovery rate at Twengsang is much better than other districts, as out of the total 46 cases, 38 patients have recovered and there are 8 active cases in that district. Kifri still remain the only district in the state that has not reported any COVID-19 cases so far. And as per the data provided by the Department of Health and Family Welfare, the state's tally of total positive cases now stand at 1,460, with 577 recovered and active cases at 878. 4 persons have succumbed to the virus from the state, and the recovery rate stand at 39.52%. The Nagaland GB Federation leaders met Nagaland Governor and interlocutor RN Ravi today and reiterated their position to conclude forthwith the peace negotiation with whatever has been agreed. A Raj Bhavan tweet said that the remaining issues, if any, to be pursued through peaceful democratic process. Meanwhile, speaking to News and Trends over phone, General Secretary of the GB's Federation, Shikuto Zalipu, said that the meeting with the governor came as a reminder to RN Ravi, who is also the interlocutor in the Naga peace process, that the Indo-Naga talks, which concluded on 31st October 2019, was yet to be formalized. Zalipu informed that the team apprised the governor of the delay in inking the final settlement, which is yet to be done even after months have elapsed since 31st October. He said that the Federation also wanted to know from the governor as to why the issue has not been resolved, though important issues have been going on despite the COVID-19 pandemic. Zalipu said that the governor told the visiting team that the government of India was sincere in resolving the issue at the earliest, and for this reason he had met the NNPGs recently, but expressed regret that the NSC and IM did not respond to his call for a sitting, citing certain reasons. The General Secretary of the GP's Federation also informed that the governor had relayed to them that Nagas will be the masters of their own land and that the remaining issues, if any, will be pursued through peaceful democratic process. With a single-day surge of 47,703 COVID-19 cases, India's virus tally mounted to 14,83,156 today, while the recoveries surged to 9,52,743, pushing the recovery rate to 64.24%, according to the Union Health Ministry data. The country's death toll due to the virus rose to 33,425, with 654 deaths being reported in the last 24-hour span. The data updated at 8 a.m. showed there are 4,96,988 active cases of coronavirus infection in the country presently. According to the data, the recovery rate among COVID-19 patients is 64.24%, while the fatality rate is 2.25%. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Delhi, Andhra Pradesh, Karnataka, Uttar Pradesh and West Bengal. In the northeast, Assam has reported 33,576 cases of the pathogen. A total of 4,049 cases have been reported in Tripura, 2,286 in Manipur, Arunachal Pradesh, 1,239. Meghalaya has reported 738, Sikkim 555 and Mizoram has registered 384 infections so far. The overall number of global COVID-19 cases have increased to over 16.47 million, while the deaths have topped to more than 6.48 lakh, according to the Johns Hopkins University. As of this morning, the total number of cases stood at 1,64,74,622, while the fatalities rose to 6,54,007. The US accounted for the world's highest number of infections and fatalities at 42,90,237 and 1,48,201 respectively. Brazil came in the second place with 24,42,375 infections and 87,618 deaths. Now, behind the scene and many times unnoticed, the Home Guard, Civil Defense and SDRF Dimapur district have been working round the clock for COVID-19 related activities since 25th March 2020. Presently, Home Guards and Civil Defense personnel are deployed in manning 8 posts in the border areas covering Dilai Gate, Borlingri, Auyimson, Newfield Gate, Khatkati, LRC, Balijan, Newton Basti and Sanctum Tila. The personnel undertake the task of thermal screening the people in the border areas 24/7. This was informed by the District Commandant, Home Guards and Civil Defense, Dimapur, Y. Khento Chishi, during an interaction with DPRO Dimapur. Besides, the SDRF team under Home Guards and Civil Defense undertook the task of transporting the body from the hotel to the morgue in COVID Hospital Dimapur of the pregnant lady under quarantine who was found dead in a hotel at Dimapur. The SDRF team also took the entire task of transporting the dead body of the 82-year-old man who passed away on Sunday from COVID-19 Hospital Dimapur to the cemetery, and burial was also done by the team following all protocols. Besides these, the personnel are also deployed for security duties in the quarantine centers, hotels, State Sports Academy and several other points. On being asked about any challenges faced, Chishi said that initially they faced PPE shortages, but added that with the sufficient supply from the headquarters and the district administration and some well-wishers, the problem has been solved. He informed that presently he deploys around 117 personnel out of the working strength of 125, including the officers. On a lighter note, the Chishi expressed that people hardly recognize them as personnel from Home Guards and Civil Defense, as they also use khaki uniform.
In 7 and we are making 8 quarantine center security, and more than that, our Jawans, they are handling the dead body for patient. We have 10 to 1 from Hotel City Palace, 1 to right, and recently last night we have transported 1 COVID patient to Nagaland and buried. Out of that, we are prepared for motion with lesser activities also other than the COVID-19.
Now, at the time when jobs and employment are hard to find and there's little avenue to earn livelihood at these times of the pandemic-induced lockdown, 2 girls from Zinaputo town have found means to earn their daily bread through baking. They are not professionally trained, but their determination and passion for baking have opened a window of opportunity for them in a venture very few in this town ever thought of. Vikali Aumi of Surmi village and her sister have opened a new bakery, Tummy Delights, at Project Colony Zinaputo. Vikali said that watching baking on TV aroused her interest, and that's where she learned this art. She said most people have the notion that only by taking baking classes can they learn the art, and many give up because they can't afford to pay the fees. But these hurdles didn't stand between her passion to learn baking. Most of the bakeries in Zinaputo before she opened her bakery have been buying biscuits and cakes from non-locals and from out of Zinaputo at wholesale rates. During the times of the total lockdown, most bakeries find it difficult to bring in the requirements, but these barriers will not stop them as they have started their venture locally. And with that, we come to the end of this news broadcast. Do subscribe to us on our YouTube channel and also follow us on Facebook and Twitter as well. And stay updated with the latest from across the world, the country, the region, and from the state as well. Meanwhile, stay safe, practice safe health hygiene, and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.